Hello, welcome. I am Dr. Felicia Ferrara, and you are welcome to Relate This To. We are a organization that works with individuals, and our goal here and our mission here is to have relationships run as smoothly as possible, especially between intimate partners and especially between family members. And all of that carries into the workplace. So you will see us do individual little workshops and trends on workplace relationships as well. So today, I would like to talk to you about opioid usage and abuse and the implications for domestic violence in the home, okay? Whether it's home or workplace. I've had plenty of violent outbreaks in the workplace. So, what we're talking about today is the impact of opioids. Opioids, in case you're not familiar with them, are like narcotics that slow you down, make you relaxed. It's not like pot where you distort it so much on your perceptions, but your entire nervous system gets a little bit dull and does not operate as fast as it typically does in your without opioid. People who have been diagnosed, women in particularly, diagnosed with opioid disorders or abuse, are more likely to have experienced domestic violence, sexual violence, and childhood sexual abuse. So why are these patterns continuing? They would have experienced those adversities more so than the average woman who does not get addicted to opioids that are usually prescribed for chronic pain and are more likely to be self-medicating themselves to cope with trauma. So depending on what age your trauma started, what coping mechanisms you have, everybody's affected different. Some are more resilient, but sometimes we refer to opioids as depressants or relaxants. And domestic violence, of course, intimate partner violence is defined as patterns of abusive behavior in any relationship that's used by an intimate partner to gain or maintain power and control over the other partner. Now, this is male and female. I've seen it on both sides. So when combined with addiction and drugs, and both parties are under the influence of either drugs or alcohol or both, the domestic violent incident becomes extremely volatile, escalates into dangerous situations. And of course, we've seen all those on our police stories. But at the same time, some of you, unfortunately, have probably lived it. It's hard to get away from a person who abuses drugs because the chemicals keep you dependent on them. You need your drugs, so you're not going to lose your source of drugs. And so, therefore, it's complicated. And our brain needs to be rewired to think differently, which is very difficult to do when you're under the influence. Okay. So future behaviors are a function of how much drugs you ingested. This can result in irrational, violent, or controlling behavior on either party within the relationship or both parties. And if both parties are, forget it, the escalation is tremendous for volatile explosions. Okay, so violence often have similar underlying characteristics, such as loss of control, continued behavior despite negative consequences, and addiction and abuse both tend to worsen over time. One doesn't help the other, they drag each other down. They have a correlated relationship. Now, both conditions involve denial. No one admits they're violent and no one admits they're doing drugs, or shame, embarrassed to go for help. So the National Center on Domestic Violence and Trauma has looked at all of these. In a particular article by Leone and others in 2005 and 2007, looked at the rate of opioids used among survivors of intimate partner violence, and it's relatively high. And a significant proportion of participants in opioid use treatment programs have experienced intimate partner violence because there's no boundaries. Once you're under the influence, anything's possible. Abuse, trauma, violence throughout the lifespan, that just plays a key role in that survivor's life, but also perhaps draws them towards the use of opioids to dull the pain. We all know about that. Everybody wants to dull the pain. So intimate partner survivors violence use opioids to encounter even further violence because now they have no control to stop it, no control to make a good choice to leave or to make a plan. And that includes further substance abuse that directly threatens their physical safety and well-being. And that's the problem. Now, survivors of color versus white individuals face additional risks and barriers to treatment because of systematic bias, and bias on their part as well as on the part of the provider. For instance, in a Black family may find more shame in going forward to get help. It just isn't done, it stays in the family. And there may be money problems where your finances are cut off. So therefore, you're not going anywhere. And similar to any comorbid afflictions, without understanding one of the specific ways that intimate partner violence and opioid use interact in their lives, survivors don't see clear how to fix the problem. So the substance use disorder in treatment program cannot be as effective if you don't address both parties. Why are you in a violent relationship and why are you abusing drugs? They need to go together. Also, survivors who are using drugs are at greater risk of injury by overdose because they're changes of mood. They're not addressing both issues, domestic violence and opioid use and abuse. And enabling codependency in both instances. You're codependent on the drug and you're codependent on your partner, the one that's hurting you. So you don't leave and you accept more and more abuse on both parts. Passive tolerance is what we call it. Passive tolerance of abuse and inability to make healthy boundaries for yourself because you're not thinking straight thanks to the drugs. So they all play into the problem. And until you take care of both issues, it's going to be difficult to get better. Violence in the home has such an impact on mental health and substance use and abuse. Over the past 30 years, research has clearly demonstrated that experiencing abuse by an intimate partner can have profound, and I do mean profound, long-term and deep effects on the health and well-being of survivors. It gets worse over time. Homicides, unfortunately, the ultimate, and as well as longer-term risks for developing trauma reactions such as post-traumatic stress disorder, PTSD, mental health conditions, chronic depression, chronic health conditions. Maybe your back was hurt. Maybe you were dragged down the stairs. All those conditions are problematic. And sometimes when you're under the influence, you don't even realize you're hurt. So you even play into the part because you can't see straight well enough because of the influence of the drugs. So you see how opioids are harmful to us. Research consistently shows that being abused by an intimate partner increases one's likelihood of, as well as associated harmful consequences to self. Opioids, in case you're not aware of it, they are comprised of things like naproxen and anything that's like a sedative, Tylenol. At the same time, research does suggest that people who use substances are significantly more likely to experience abuse. And that's been established as compared to people who do not use substances. If you're not using substances and you're not under the influence, you can see straight. You can see well enough to make a plan. The hardest part is to make that first phone call out to a community agency. And once you do, you connect with a real voice on the other end of the phone, and you realize there is help out there for you. Now, studies found that 47 to 90% of women in substance use disorder treatment centers have experienced domestic violence as well. And that's pretty common because of the influence of the drugs. Maybe your partner's on drugs, you're on drugs, and that's the way you enjoy sex, or that's the way you're coerced into using it. Or maybe you don't even enjoy it, but maybe you just do it to please him and be quiet so that you don't get into a violent situation. In addition, substances that are used by survivors increases the risk for assault by your partner. So while you think you're having a good time and you're smoking and maybe you're getting stoned, maybe you're getting high, maybe you're getting low, maybe you're using your opioids, all the while the other person is getting a different reaction and anger may burst out and you're not in a condition to make a wise decision how to leave that room safely. So this is a problem. So both victim blaming and substance use related stigmas are common out in the public who have never experienced this. And so it is imperative to recognize how hard it is for a woman who's been abused or a man to really come forward and admit the things that are happening. You have to make a full commitment if you're going to come through this. You can't break through an abusive relationship if you're still going to be using the substances. So you have to make up your mind. It's time to let things go. In most cases, when people are fed up and had enough, that wall goes up and you're ready. So a study of women who had attended a methadone clinic found that 90% had experienced domestic violence in their lifetime. 90%. That study was done by Engstrom and others in 2012. So you see, other studies suggest that most people, particularly women who use opioids, have been abused by intimate partners, and it will continue until the use or excess use of those substances stop. It's not easy. It's not easy. It may take a whole team to help you. However, the rate of opioid overdose deaths among women has increased at a really startling rate since 1999, 2015. So you might say to the year 2000 until 2015. That's 15 years. You see the rate increase over 471% of opioid overdoses among women. That is huge. And why are women just drawn to that rather than to get help? Synthetic opioids related to deaths increased 850% among women in that time frame. So it's a devastating problem. The impact of drugs. People laugh about it. People think it's cool. People think it's, something cool or whatever it is. But the same thing has happened in younger people, younger women, ages 30 to 64, where as many as 91% increase in heroin-related deaths and a 1,643% increase in synthetic opioid-related deaths. That's by a study by Rhea Newton and others in 2019. So the continued increase in opioid-related deaths among women is likely due to multiple factors. In discussing gender and opioids, we cannot understate the role, stress the importance of the traumatic life experience that person has had, including intimate partner violence, probably child abuse, violence in the workplace, and in the development of an opioid use related, drug related problem, the woman is trying to cope. Now, this is even worse among transgender women because people who are experiencing specialized problems really need to take a different look at it and to seek out help. There are less programs that specialize in that area and needs to be addressed. So the emotional distress are risk factors for opioid use. You feel distress before I take a pill and I wipe out the problem, but you don't. You make the problem worse. So you're not making the problem better. So compared to men, women have 3 times greater odds of having both PTSD disorder and problematic prescriptions abuse for opioid use. Okay. And that was another study done by Meyer and others in 2014. So there's evidence to suggest that people who are transgender may be at increased risk for even more problems. So that's transgender either way, male or female. More problems associated with opioid use, in part because of trauma and stressors going on in their lives, associated with the gender-based discrimination and violence within the relationship. So you see, we have a lot of work to do. And very often a transgender person is more fearful to come forward because of this lack of understanding from others or fear of discrimination from others. So women and people who are transgender are at greater risk for developing an opioid use or abuse problem. It's up to us as health workers, health providers, community associates, family members, whatever. Those of us who are concerned about these issues need to help build programs that are diverse enough to address these different problems. So I hope this short little video makes you aware a little bit. I think we all can look around at our family members or friends and look at some people who are going through abusive relationships, and yet they wouldn't dare think of breaking that violence pattern or stepping out against the partner to get some help. unfortunately, people often wait till it's too late, and they wait for a very long time. So the National Domestic Violence Hotline number found that substance abuse coercion in a partnership is also very predominant. So one party may not want to be under the influence, the other party's pushing it. So those are studies that have showed that. You may know that amongst your friends. You may be aware of some of these. In hotline callers, about 26% reported that they have used alcohol or other drugs to reduce the pain of being abused. So we know there's other ways that they might also reduce the pain, and that be self-cutting, self-harming, and your respect for yourself is decreased and depleted every time somebody insults you, every time somebody hurts you physically, every time somebody forces you to do something that is against your will. So all of those little actions take away from your own psyche and make you weak so that it's difficult to come forward again. So we need to rebuild that strength. About 50% of callers to the hotline tried to get help for substance use. So that's a very small amount, whereas 60% of those callers also reported that their abusive partner tried to prevent them from getting help or discourage them. What do you want to do that for? Well, this is high. We have such great sex. Let's keep it up. We can do this some more. Meanwhile, you end up getting hit in the end or abused in some other way. So, and about 37% of people in the hotline admit that their partner threatened them to report their substance abuse to authorities, and they're afraid of getting arrested. So again, they're not going to go call domestic violence if their husband or their partner is holding it over their head, that they're going to go ahead and call to get you arrested. So this just goes on and on and on. All right. I can't stress this enough. I'm going to leave numbers below for you so you can call for help. And you can always call the police for help and have them come out, but you need to tell the truth when the police get there. And that's what happens between the time you make the phone call and the time the police actually arrive. The woman or party who's offended loses strength or confidence. And whether they're under their influence or not, sometimes the police may not believe them if they're under the influence. And depending on which one of you is the better talker, you or the partner, they may be able to talk themselves right out of being in trouble. So you see, it's very complicated. We need to get help for you, and there is help in the community. So besides trauma and fear, you're afraid of harm or risk from your partner, and you're not going to be able to cope with it while you're under the influence. They like to keep you under the influence, so therefore there's more control for them. Chronic pain will bother individuals who go through this throughout their lives because it follows them. You can't get away from it while you're still under the influence. There are reports of pain that many doctors don't believe. Medical professionals think you're just doing it to get more drugs out of them. So those, again, are things that need to be addressed. You may be less likely to have access to medical care and insurance because your family may not have it. And of course, anybody who is pregnant under those conditions avoids seeking treatment or neonatal care due to abusers or control or threat. And of course, that now you start to hurt the child and more complications arise in your life. So you can't go back and undo that. So it's very important that you get. Hopefully you like this video, and please give us a thumbs up below or subscribe to our channel. We really appreciate it. And since this is a very serious problem, we are leaving resources for you below in the description for the National Hotline of Abuse and also the SAMHSA for drug abuse. I wish you well, that you and your family can succumb this and have the harmonious, blessed, and loved relationship